Good evening, everybody, and welcome to our talk. Today, it's not yet Valentine's. Not yet. There are no Valentines in my time, so I'm learning them from this generation. So I don't even know what the date is and when it is supposed to be. So it could even as well be today. Anyway, welcome to our talk. We are talking again from the platform of She Chooses to Live initiative. We keep saying that that's a platform that wants to give knowledge to everybody, knowledge about themselves, especially knowledge, gynecological knowledge to do with male and female reproductive systems, because that's where we are expert at. But whatever age of that of people, from all the way from teenage to menopause and andropause, anything that is reproductive health, then She Chooses to Live wants to give knowledge to people. We've found a lot of lack of knowledge, and that's why it's become such an important thing to give this knowledge. I'm called Dr. Wakai. I've been sitting as a gynecologist for many years, and what amazes me and what bothers me really is how little knowledge of ourselves, and especially women, that we know of ourselves, and that is a bit bothersome. So we thought we'd put up this and keep talking to ladies to give them knowledge, so that they would understand how their bodies work, and hopefully be able to make right choices because they know. Now with me here is my tech guy. She's called Marion Wakahe. I keep saying she puts me on Facebook and removes me from it again, and keeps me talking. No, talking I talk. She keeps me there. Makes it possible for me to talk. So here she is. And thank you very much. We hope you've enjoyed your year, and for those we haven't met this year, Happy New Year again. So we last month and the beginning of this month, there was Cancer Month, and we said sorry to, rather we stood with the people who are suffering from various types of cancers. And I always have to talk about my pet cancer, the one that called cervical cancer, because it doesn't have to happen. So kindly reminding us that we need to do pap smears. We need to be available to do pap smears. Even in this COVID time, cancer doesn't stop happening because COVID is happening. If anything, maybe it happens even more because people will not get checkups in time because they are afraid of going to hospitals. But it's possible to do all the protocols that need to keep COVID away, and have yourself done a pap smear or done a VIA in the government place, so that it is possible to follow up how your cervix is going. So having talked about now that cervix, let's talk about, today we are going to talk about urinary tract infection. Why many people have asked about this urinary tract infection, and in the process I've come to realize that people, when they talk urinary tract infection, they're not, they don't really know what urinary tract is and what urinary tract infection is. So I wanted to clarify, because urinary tract infection is a very serious infection indeed. It's something that should be taken very seriously. It shouldn't be allowed to progress. It can occur, but it should not be allowed to progress, because it has very not welcome outcomes finally. So first of all, anatomically, what is called the urinary tract? And the urinary tract consists of several organs. If we start from the top, we start with the kidneys. Usually somebody, both male and female, they are born with two kidneys. The kidneys are like a big bean that is located somewhere at the back of the body, just below the last rib there in the front. in the flank, there at the back, below the ribs. So they are a bit in the middle of the back, but below the ribs. That's where the kidney is located. And sometimes you'll hear people say they were kicked in the kidneys. If you're kicked in the middle of the back, the kidney could actually be kicked because it is found there. So there are two kidneys that are found in that position. Now, to alert people, there are some people whose kidneys are not found in that position. There are some people that a kidney can be found in the pelvis, whether they are male or female, they can be found at the wrong position in the pelvis, and these are called ectopic kidneys. There can be one kidney in the pelvis or both kidneys. Sometimes they can even be attached to look as one, the both kidneys. And if that happens a few times, unfortunately, these kidneys have been removed from somebody thinking that it was a disease, thinking that it was something swollen in the abdomen. And this is a very, very serious state indeed, because somebody cannot do without their kidneys. They are very, very important. So we have two kidneys somewhere below at the back, below the lower ribs at the back, both sides. And some people it can be in the pelvis. Sometimes when we as doctors feel somebody's pelvis, we can feel something swollen, and occasionally we do an ultrasound, and that is, we find it's an ectopic kidney, and tell people that their kidney is there. Now, the kidney is the one that manufactures the urine, and from there is a pipe called the urethra. Now, this pipe takes the urine from the kidney and lets it flow to be stored in the bladder. The bladder is a storage tank, so that when it is time and convenient time to urinate, then one urinates. Now, each urethra, each kidney has its own pipe or urethra that drains into the bladder and keeps the urine there. Now, let's talk about the bladder. The bladder is a bag. It's basically like a bag that expands and contracts. It's got very interesting muscles to be able to push the urine out sometimes, and it's to also be able to expand and let urine stay inside it. It has got a capacity of about 400 to 600 ml of urine when it is full. The bladder is, I think we all know where our bladder is. It's found behind the pubic bone, just in the lower abdomen. When it is full, and especially sometimes in the morning when one hasn't emptied their bladder, then if you feel the lower abdomen, you can feel a swelling there, and that is usually the bladder. Now, the bladder expands to let urine be accommodated in it, and keeps it there until such a time as it's needed to be urinated. Now, it keeps it there in two ways. It has a sort of two gates. One minor gate between the bladder itself and the outlet, which is the urethra, which we are going to talk about. And another gate is found at the tip towards the end of the urethra. Now, these gates keep the urine in position so that you will only voluntarily urinate. There are some times when that is overcome by things like we call incontinence, and we can talk about that a bit later. But normally, one will be able to hold urine for a long time. Now, I'll digress a little bit here and talk to women about Kegels exercises, because when we do them and we form the pelvic floor, then we are able to hold urine for a longer time. Mark you, it should not be the rule to keep holding urine. That's not a good thing. But there are times when you must hold urine. Now, in the male, one of the gates helps to lock off, to interchange so that when urine is passing out, semen is not passing out. So in the male, it's a bit different. The gate is made a bit differently. Now, after the bladder, now comes the final thing that opens to the outside and is called the urethra. This urethra is very interesting, very different in men and women. In the women, it's a very short pipe indeed, about 3 to 5 centimeters in length only. It is located somewhere, it's not in the vagina. It is located between the vagina and the clitoris. They are not one opening. They are actually two openings. It's just that the lips cover them both. They cover, the labia cover both the vagina and cover the urethra. So the urethra is an independent opening that opens between where the clitoris is and where the vagina is found. So in the women, it is very short indeed, and then it has also an outside gate, the urethra of the woman, somewhere towards the outside of those 5 centimeters. There is a gate that one releases to be able to urinate, and sometimes if that gate becomes a bit too tight, there is problem in holding urine and infections can happen. Or if that gate gets a bit loose, then there is a bit of incontinence. So now there is a difference between the male urethra and the female urethra. One of them is that the length is very, very different. It is, a male urethra is about 20 centimeters long, and it opens not somewhere hidden, but at the tip of the penis. It opens at the tip of the penis. And this is the same urethra that is used one time for passing urine and the other time for passing semen. So it is got a gate that, like I said, locks. When it is semen passing, it locks the urine out. When it is urine passing, it locks the semen out. So it's a gate that it's a bit different in the male and the female. So what is the function of the urinary tract? Now that we have talked about the kidneys, we've talked about the ureters, the pipes that bring out the urine from the kidney to the bladder. We've talked about the bladder. We have talked about the pipe that finally lets out the urine. Now, the urinary tract is very vital in the system. In a human being, in even in all animals, the urinary tract is very, very vital. It does several things actually, not just urine, but let's start with the main one. The main one is that it filters. It's the kidneys take blood and filter the blood and remove all the impurities and remove things like urea and pass them with water into the urethra to become the urine. So they remove bad, poisonous products, things like urea from the system. They even remove medicines, the medicines that we swallow, much of them. Like if you ever take a medicine with penicillin, like augmentin, once you urinate, you will smell that augmentin smell. So they remove the medicines also. They help to balance many things. They balance some chemicals that are very vital in the system. The kidneys balance things like potassium in the system and sodium and phosphorus. So like if potassium were to be unbalanced, it's a very dangerous mineral. It can actually make the heart stop. So the kidney, it's the job of the kidney to balance those minerals. So it removes the waste of the urea, it balances the minerals in the system. The kidneys are very vital in controlling blood pressure. If the kidneys are sick, one will have blood pressure. So the kidneys are very, very vital indeed in that. The kidneys also participate in the formation of blood. They form some hormones that help in the formation of blood. So if the kidneys are sick, then one tends to also get to be anemic. The kidneys also keep the body balanced from being too acidic or too alkaline. That's the job of the kidney that keeps them balanced like that. Now, and especially for women, older women, the kidneys are very vital in bone health because they keep the calcium and the phosphorus balanced. So we need our kidneys for bone health. And then the kidneys help to balance the body fluid. If you are at a place where you are very thirsty, then they will make your urine very little and very concentrated. If you have a lot of water in your system, they will remove the water. So they balance the amount of fluid. So it's a very, very vital system. And if it goes sick, you can imagine what things go wrong. The urea is not removed, the poisons are not removed, things are not filtered from the bloodstream, and then the body actually gets poisoned. Now, let's talk about the infection. What causes urinary tract infection? And many of the infections are caused by bacteria. The most notorious ones come from the system of the gastrointestinal system, and they are usually passed around the anal region. So most of the infecting organisms that cause urinary tract infection, they come from the from the gastric system, from the anal system. There is one very notorious one called E. coli. E. coli is responsible for causing basically 90% of all the infections that are urinary tract related. There are others also. There are other things like Klebsiella. There are other things that you find like Staph aureus. And all these usually are that they are usually found in that area of the anal region, and they can be easily transmitted into the urinary tract system and cause infection. Now, there are others like which would cause infection only in the urethra, and these are some of the sexually transmitted infections. For example, if somebody has gonorrhea, then the urethra, the outside pipe, is very, very affected by things like gonorrhea, affected by things like chlamydia, and this can cause very, very nasty urinary tract infections, but the lower tract. So it is usually a bacterial infection. On rare occasions, and especially for people who are immune compromised for whatever reason, and people who are like diabetic, then they can have things like candida infect the urinary tract system. They can even get things like herpes, viral infections, but those are very rare. The commonest is a bacterial infection, and the commonest bacteria that does that job is usually E. coli, which accounts for about 90%. I should have told you from the beginning that we are unlikely to finish this topic of urinary tract infection. It's very large, and I don't want us to rush through it and not understand. So at some point, I'll tell us that we stop there and get questions until the next round. So let's talk about who is at risk of getting urinary tract infections. And the answer is that everybody is at risk of getting urinary tract infection world over. But, and women being, listen very carefully, just being female puts you at a very, very high risk of getting urinary tract infection. In fact, if you compare the urinary tract infections, a woman has 8 times a chance of getting urinary tract infection as a man. That's how serious it is. The female, just being female, is very vital. And also, throughout our lifetimes as women, 20% of us will have experienced urinary tract infection at some point. So that's how serious it is. So urinary tract infection is usually a female infection. It's also in the male, but more so you'll find it more in the female. And why is this? The female anatomy favors urinary tract infection. Two reasons. One is that we agreed that so-called the outside pipe that takes urine out is situated somewhere between the clitoris and the vagina, and that is very close to where the anus is found. And that is also very close to where sexual intercourse happens, so that sometimes the sexual intercourse will carry some E. coli from the anus, pass with it into the vagina, and the urethra is just there. So the urethra is a beneficiary of what it wasn't supposed to catch. So for that reason, the fact that it is situated there, right there, where the anus is not very far, and then it makes it, and there are even things that will help along to bring in the E. coli around that region, then it is very, very easily infected. And the second reason is that the length of the urethra is very short. Like I told you, the length of a female urethra is 3 to 5 centimeters in length, very short indeed. So that if a bacteria enters the outer area, is placed at the outer area of the urethra, it takes very short to get to the urethra of the bladder. And then the urethra, the female, the second inner gate is not as easily closable as the outer gate. As the second inner gate is not as easily closable as in the man. So that once it enters the outer gate of the urethra, then it is able to actually climb into the bladder. So that is the reason. The two reasons. One is that the urethra is situated right there, where it is very easy to pick the infection, and also that the urethra is very, very short. And the other thing is that sometimes as women, when we are having periods, we wear pads which cross over from the front to the back. By the way, the pads are the best things that you should wear, not tampons. But we wear those pads which cross over from the front to the back, and there is dead blood there, which E. coli also like to catch on and eat, and also climb to the urethra. So for those reasons, then just being woman is enough to put you at risk of catching urinary tract infection. The other thing is still being woman, but this one is being menopausal. When estrogen goes down, which is what happens when one gets into menopause, the level of estrogen goes down, then the whole area of the pelvic floor becomes very loose, and it becomes very thin. So it's very, very easy to access by bacteria to where the urethra is. And also that because the pelvic floor becomes very loose, sometimes the menopausal woman is not able to pass their urine completely out, and there is sometimes some stasis that they'll go to the toilet and then up they go and another little one comes out. And because of that, because of static content of the urine, menopause is a time when urinary tract infection is very, very, very common indeed, and should be one at menopause should be very alert that they can get infection. The third thing is if somebody's bladder is what is called prolapsed. When we get, especially when we get very, very many babies and we deliver them through the vagina, then we loosen up the pelvic floor. And once we loosen up the pelvic floor, then the bladder sort of prolapses. In fact, prolapse means falls out of the body, outside, goes down. so that when you cough, then the bladder is sort of pushed out via the vaginal opening. So when that happens, then the angulation of the urethra is odd, so that it is never possible to pass urine directly, and one is always having excess urine in the bladder. And the mere fact of excess urine and with the urethra again so near where infection happens, then it is very, very easy to get an infection. In fact, sometimes these bladders are so prolapsed that we have to surgically return them into the body system. So let us kindly do Kegels exercises before we start prolapsing bladders. If you want, we can talk about Kegels exercises at some point, but they help to keep up the bladder and the urethra and everything else in position. Now, the other people who are at risk of getting urinary tract infection are the pregnant ones. This is one, the pregnancy itself blocks the easy flow of urine and makes it a bit hard for the bladder to empty itself. It is sat on by the baby and the baby's head kicking around there. So the bladder is not able to empty itself very, very, very easily. And the other thing is that the ureters are sort of distorted. The ureters, the ones that take urine from the kidney to the bladder, can be distorted, can be pushed out of position by the growing uterus. So for that reason, they don't flow very easily. And in pregnant women, urinary tract infection can ascend very quickly and go towards the kidney. So in pregnancy, we have to be very careful about. And the other thing also about pregnancy is that their immunity is down, so that whereas they are not able to fight infection as easily as anybody else who is not actually pregnant. Now, who else is in chance of getting urinary tract infection? Now we come to the male, both male and female. If somebody has a kidney stone, the kidney stones are things that they are called renal stones. They are stones that are made of things like calcium, solid things, and they flow and they are very painful. They go through the urethra and they can be very painful. But if they block the urine flow, then the mere blockage causes urine infection to happen. So both male and female, if they have kidney stones, they'll keep getting urinary tract infections. In the men, especially, no, not especially, because prostates are only found in the men. If prostate is enlarged and there is blockage of the urine flow, then the man stands a chance. This is the one time the man stands a chance of getting a urinary tract infection. That's the 1 out of 8. When 8 women are getting, then the one man is getting. Sometimes it's because the prostate has blocked the outlet of the urine, and it is making it impossible for urine to be emptied, and so it makes it hard and makes it easy for infection to happen. The other thing that is a cause for urinary tract infection is general lowered immunity of any nature. If somebody has unmanaged HIV, if somebody has unmanaged diabetes, if somebody has leukemia, if somebody has some organ transplant and they have been put on things to lower their immunity, then they stand a big chance of getting urinary tract infection. And another lot of people that are very, very prone to urinary tract infection are those people who need to constantly have catheters with them. A catheter is a pipe that empties urine from the bladder and out. And these are people who have got spinal cord injuries, the people on wheelchairs, because they will not be able to feel their urine, the urge to pass urine, and they may not even be able to hold the urine inside. So they are inserted a catheter to keep draining their urine into a bag, And because of the catheter use, then sometimes that can cause infection. In fact, there are times when we are doing surgery and we injure the bladder a bit, and we have to let the bladder stay, the catheter stay inside the bladder, so that it keeps draining the urine so that the bladder heals. When we do remove that catheter, the first thing we do is send it to the laboratory to find out whether it has an infection that it has introduced into the bladder, and then we deal with it. So people who live with catheters do have that chance of getting urinary tract infection. Now, I think I'll stop there for today. The next time we come, we will talk about how do you know the signs and symptoms of the urinary tract infection. We'll talk about the investigations that need to be done for urinary tract infections. We'll talk about the complications of urinary tract infection, which is untreated, and we shall talk about the management, the treatment of urinary tract infection. We will cover those 4 things, but I feel we cannot do all of them and do good justice, because urinary tract infection is a very, very important something. It's the same one that finally kills kidneys until one needs to have dialysis. So we need to have clear exactly what it is that it is, and we make sure that we do not get untreated urinary tract infection, because it is very, very easy to treat indeed. We never need to get to the level where we are needing to have kidney transplants or to be on dialysis. So we'll stop there today, and next round when we talk, we shall talk more about those other things that we haven't covered. It's quite a big topic. Now I'll have questions about so far where I've covered. Yes. Tech guy, you can come back in. So they're usually here. Their number. Oh, there is hi. Hello, 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 hi. There are no questions.
Oh, someone has said, say hi to Tech Guy. Thank you, hi.
Hi, Tech guy.
Is this the one in London? Someone in London?
No.
Someone else.
Yeah.
I don't think there are any more questions.
There are no questions today. Yeah, today it was just anatomy and what to expect. I expect questions next week. Yeah, that will be the hot time. So hopefully next week we shall cover those what we have talked about. Yeah. Oh. Okay. All right. So good. We call it today. We call it a night. And then you also tell me whether it is better. I think it is better. There's a question.
Please explain again why menopausal women are unable to completely empty
their bladder. Okay. When we get to menopause, I usually show people my fingers. You can see my fingers. You can see the skin of my fingers. That's what menopause does to us. It wrinkles us and it thins us. So what happens is the whole of the pelvic floor goes thin, and no tone. Let's say the tone disappears unless we have actually worked it out. The good thing about the pelvic floor is that we can tone it even if we are menopausal. It's not like my fingers. I can do nothing about my fingers or my neck, but I can do something about my pelvis, and those are called kegels. Anyway, the tone goes down, And so the urethra, the bladder is now English fails me. The bladder is, floppy, and and the urethra is also easily openable. So it and the muscles of the bladder, if we haven't toned up, are not easy to push out the urine. So usually in menopause, we always have a little residue. One will go to the toilet, finish, and then they are waking up, and a little bit comes out. That is menopause. But we can overcome that even at menopause by doing pelvic floor exercises. And those are called Kegels exercises. So that's the reason. And the reason why also, because of the lack of emptying, and also because of the thinness of the surrounding area and the urethra, the thinness of the skin, well, not the skin, the wall, the covering of the urethra, then in menopause we tend to get quite a bit of urinary tract infection as compared to younger women.
Those Kegels, you just hold urine.
Yeah, you you know, Kegels is a very nice exercise. You do it in your house. You go to your house, you remove your you go not to your house, to the toilet. You go to your toilet, and I hope you have a sit-on toilet, because this is where it takes quite a bit of time to urinate. So you go to the toilet, you remove your panty completely out of your way, of both legs, and you sit with your legs very wide apart on the toilet. And the reason for this posture is because the buttocks have a habit of helping you to stop urinating, and you don't want the buttocks to help you. So when you have when you are pushed with urine, when you are somewhere, you tighten your buttocks, and then you sort of hold the urine. So the sitting with legs wide apart is to make sure. I have to take water to make sure that your buttocks are not the ones being exercised, and you're just exercising the pelvic floor. So you sit, and I think it is called the susu. You urinate a little bit.
It's called urine.
It's called urine, not susu. Okay. urinate a bit of urine. Tech guy can be very naughty. You urinate a bit of urine into the toilet, and then you hold. You hold. You hold quickly. you hold. You try to. Let me say the word try. You try to hold the urine, and then you count 1, 2, 3, up to 10, and then you release again gently, and you pass a bit of more urine, not susu, a bit more urine, and then you hold again. So when you're in the toilet, you'll hold each time about 10 times. Each urination you hold about 10 times, and each time you hold, you try to count up to 10, and then you let go. So you do that for 3 times, 3 urinations in a day. Sorry, by the time you are finishing a week, then your brain has picked up what it is that you do in the toilet, and you can do this exercise now outside the toilet without having to jump your tummy up and down and jump your buttocks up and down. So the first week is to learn which muscle you want to tighten. Thereafter, there is a way that we progress with the number of per week, and then we reach the peak, and it is to be done for life. If you want more details, just call my office. They'll tell you about. They'll give you a schedule of Kegels. So that's Kegels exercise, and it can be done at any time. Any woman who has ever been pregnant needs to do Kegels. Not just those who have delivered through the vagina, but even those who have delivered by cesarean section. The mere fact of being pregnant loosens the pelvic floor. That alone, the hormones of pregnancy loosen the pelvic floor. So even if you've always delivered by cesarean section, you still need to do the Kegels exercises. Yes, but of course, more importantly, are those people who have delivered normally. They'll, if you do Kegels and do them nicely and keep at it, you'll be able to hold your urine even when you are my age.
Another. The next one is by Lydia Picta Wangi. Hi, thanks, Doc. Kindly, what can one do if UTI is recurrent?
Let's talk about that. Treatment prevention will come next week. Let's talk about that. But you shouldn't have recurrent UTI. Please see your doctor and get it sorted. UTI is not something you want to keep recurring. It's not a good thing. But we'll talk about that next week. Tune in, and then we will answer that question then.
Okay, there's another lady. She says, "Hi, I keep on getting UTI at least twice a month. I'm always on antibiotics. Please advise."
Again, that one, when we come to investigations, we shall explore whether it is truly UTI you get or not. So let's please tune in next week. We will explore more. I know today was just the anatomy of how what you look like, but next week there should be deeper, and you can ask all these questions then.
I think for me, I have a concern about this. If you're always on antibiotics, there must be something resistance. Yeah.
Maybe not. We will explore when it is that you need to take antibiotics. Yes. Yeah.
Okay. Can UTIs be sexually transmitted?
Yes. Let me answer that in two ways. There is a UTI that can be sexually transmitted. If it is gonorrhea, it can be sexually transmitted, and that can cause UTI. UTI, you see, like we said, it starts all the way from the urethra through the bladder and up the ureters all the way to the kidneys. So yes, that is a way that it can be sexually transmitted. Yeah. The other way is not sexually transmitted, but transmitted during sex. Because usually, like I said, the penis has no eyes. It has a habit of collecting things around that region, including where the anus is, and taking the E. coli, the bacteria that are found in the stool, right where the urethra is. And then, like we said, the female urethra is very short. You take quickly and send to the bladder. So yes, it is help the not helpful. The sexual intercourse assists in sometimes in causing urinary tract infection, but the infection is not from the man. It has come from the anus of the woman. So it's transport. Yeah.
So she should take a shower.
Yes.
before.
Yes. Ideally.
Okay. You can say, "Welcome back, Daktari."
Thank you. Thank you. We have missed you also. What is this? What is there a difference between
UTI and candidiasis?
In fact, that is a very important question, and that's why I raised this UTI, because at the end of the talk next week, I'll tell you what is not UTI. Candidiasis is not UTI. Yeah. In very immune compromised women, candida can cause UTI, but the candida we talk about is not UTI. Yes. Yeah, because I keep hearing itching. I have UTI. I'm always having UTI.
That's not what it is.
Yeah, that's why we decided to talk this UTI thing.
Okay. I don't see any other questions.
I think that's it.
Thank you for viewing.
Thank you. You're welcome. Next week it will be a bit hotter, so we shall discuss more, I'm sure. Yeah. But it's not possible to do it all in one go. I want you people to get it and to understand and to know what to ask your doctor when you go to your doctor, and to know when things are going wrong. Yeah.
Okay, so this is Nelly. She asks, when should we tune in for the continuation. So I think it's next week, the same time, Friday 8. We've changed it to 8 p.m. For the purposes of, for those who want to get home, who want to settle in. So it's 8 p.m. Friday next week.
Yeah, Friday next week. When is Friday next week?
19th.
Oh, 19th. Yeah.
Should be
Yeah,
19th.
we will do it, God willing, on Friday next week.
Mm.
We are ready. It's just that I know you can't take it all at the same time. Yeah.
Also discussing frequent UTIs can cause fertility issues.
But we'll get into that. Those are not the same system.
Oh, they're not?
No, they're totally different systems.
Also, an STD and the UTI are not the same thing.
No.
Can one be the other? No.
Yes, an STD can be a UTI. And a UTI can be they can be. But STD, we are talking STD of the Oh yeah, there is a way it can cause infertility, but that's in men, and we'll go into that.
Oh, in men.
Yeah.
Okay. Says, all right, thanks a lot.
Good night. That's it. Okay. We say bye-bye. Okay. Yeah, it is late. Is it late?
No, it's
not. Yeah,
late.
it's almost 9. Bye-bye. See you next week. Tune in. We shall talk about things that are hot that day. Yeah.
Okay. So this Nelly says, thank you so much. Be blessed.
Thank you.
Is there anyone? No.
Anyway, see you next week.
Yeah.
We can
discuss then.
We can discuss.
All right. Good night, everyone.
Good night.
Good night.
Stay safe. I want you here next week.